the speed of technology development might very well surpass the aging speed. So we kind of competing with time. And I believe the capability of our technology to be able to make our life immortal, it is within the reach of our generation. With the technology, we can outlive our physical body that can keep our cognition alive and thrive through a combination of carbon-based life form and non-carbon-based, silicon-based life form.
This episode is sponsored by AI Your Superpower. Want to get seen, chosen, and recommended by AI? Go to aeo.iiyoursuperpower.com and download your free AI visibility playbook to stand out and grow with clarity.
Hello, and welcome back to Happiness by Habit, the podcast where we explore habits, mindsets, and innovations that shaping how we live, grow, and thrive. Today's conversation focuses on longevity, cognitive health, and the future of innovation in healthcare. I am joined by Dr. Wallace Lynch, technologist, founder, investor, and managing partner of Noatech, a company working on innovating approaches to cognitive health and early detection. Welcome to Happiness by Habit, Dr. Lynch. I'm so happy to have you here.
Morning. Hi, everyone.
Hello. So, I would love to get started. If you can share with us a little bit about your journey. You have an amazing journey. What led you to the work you are doing today, Dr. Lynch?
Sure, definitely. As we all know, the world is changing fast. Actually, it's faster than we can expect it. So everything nowadays that it is going on with our life, it is not going to be the same for the last even a decade. So the technology that we have been working on, it's actually have been evolving very fast, beginning from the regenerative approaches through stem cells and the researches that we have been working on with the brain-computer interface, that all the whole consortiums of the way that we recognize how this body works and how our technology can facilitate us to live longer, live better, and maintain our physical and cognitive health better. It is fundamentally changed. So I cut in through the regenerative industry with the company that I have been advising about 10 years ago from the technology side, from the information technology side. And then, because of the fusion, we gained a lot of involvement with the development, clinical trial, and step by step that we launched our clinical trial on cognitive and regenerative therapies to enhance and to prevent the cognitive impairment. So that's the trajectory. So me, myself, I'm an economist, a scientist. And through the fusion of different disciplines of technology, that it is the beginning of the journey for regenerative maintenance therapy and treatment of the whole human species.
Wow, amazing, Dr. Lynch. I remember you and I met last month in Austin, and when you told me what you do, I was like amazed because it's such a powerful topic, and nowadays everybody is looking for some kind of a solution in this matter to live healthy and to have more time in life, because right now possibly time is one of the assets that we don't that are more precious for people, right? So
Yes.
this is fascinating for sure. I would love to dig a little deeper into this. What inspired you to focus on cognitive health and longevity through Noatech? Tell us a little bit more about Noatech.
Sure, definitely. So Noatech is a biotech company that we focus on two main themes. One is cognitive health and quality. Second is regenerative way to maintain, improve, or even modify our cognitive quality of the life. So as we know of that a pile of flesh does not make life, right? And a primitive form of life, it doesn't have cognition. So what makes us unique in this universe is we are cognitive aware. We have cognition compared to the other form of life. So this is the true human that we know of. if we lose our cognition, then we're going to be in the vegetation state. Even technically, biologically, we are still alive, but as a human being, that we are not there. So cognition, the quality of our cognition, it is the most important thing to human being. And at the same time, for regenerative therapies, that's one of the very few true methodologies that we can maintain the biological and physical body of human being in a good shape, and sometimes to improve it in a better shape. Because when you are sick or you sustain a certain injuries, then you can take medicine, you can take surgeries to repair, but the scar is there, the damage is done. And regenerative approaches is basically to replace the damaged and aging tissues and cells with the fresh, new, rigorous cells and tissues to replace the new parts, but it is generic to our body. It can be used. So it basically it's regrown the new part of yourself. So from the biological physical basis to the operating system, which is our cognition, that both keep it in a good shape and gradually that we could even improve and enhance it. That's the true path to a better, healthier future for the human being.
Fascinating. So, regenerative. What does it mean for the humankind or for our generation alone?
Sorry, what, the older generation?
Yes.
Okay. So in the past that we take chemical drugs, we use physical surgeries to repair, to help our healing. But ultimately, that if you really taking a look at how our human body recover from sickness or injury, medicine does not help. It is our immune system. So medicine's surgeries facilitates the healing, but it does not do the healing itself. All recovery or healing were done by our immune system. So regenerative therapy, primarily going through the stem cell regenerative therapy, it is leveraging a new enforcement of the stem cell, which is the universal cells that can morph into any type of body cells. So it gives you the new building blocks, which is healthier, stronger, and much more than you can generate within your body. Because we know when we came out of the womb into our adulthood, that the quality and quantity of stem cells that our own body can generate is limited. And along with our aging, the quantity and the quality is shrinking and declining. So when you have a sickness or sustain a certain injury, then a sufficient amount of regenerative stem cells in your body and the quality of them, it is very important to the recovery. If you don't have enough building blocks, then obviously you are not able to repair all those sicknesses and injuries. But when you import the healthy and high quality stem cells, that will greatly help your immune system to rebuild yourself. So basically it's a and rebuild from inside. So that's completely different from the older generation of relying on medicine and surgery to help you recover.
Wow, much more powerful path. What would this mean for longevity? How does this translate into living longer, healthier?
Sure. So let's take an example of dementia. Correct. So according to NIH's research, roughly about 1 in 5 Americans will have dementia. It is not a question of if, it's a question of when. So dementia could be caused by many reasons. The biggest one is Alzheimer, and there are many types, more than 100 types of different dementia, and there are other type of diseases that have the degenerative impact on our cognitive system, our brain. So if we use the regenerative therapies to intervene the aging process, the natural aging process, that will be able to slow down and in many cases stop the progression of dementia. What we can observe through our research and clinical trial is there are very positive outcomes that can slow down and stop the progression of dementia and possibly reverse. Up until now, there is zero medicine that can cure dementia. There is none. It has been working in the whole pharmaceutical industry for the last several decades. No medicine has been found effective, can be effectively cure or treat dementia. There is none. Several clinical trial has been working on some partial improvement, but there is no cure. For regenerative way to improve, and actually it can stop and slow down progression of the process. And this is very important because if you don't reach the point that you can lose your cognition, that will be practically that stop the process. So if your cognition declination slower than the natural aging, then basically we call it you escape the aging trap. So that's the practical way of regenerative therapies that can help us to maintain good quality of our life. This is one of the case. Let me use another case.
Mm-hmm.
Joint degradation, like arthritis, that we have our disc misplaced in our spine. And in the past that it needs to be used surgical replacement, and it does not have a guaranteed result. So the surgical approach that it replace our disc in our spine, replace artificial joints, but the result is never guaranteed because you can really predict that how these stainless steel titanium joints or ceramic joints that fused with your bone, and after the surgery, you always have the side effect when you have the rainy weather, you have the change of the temperature, your joint will have the pain. And the lifespan of the artificial joints are not good. So that's the problem of the older medical and surgical method. For regenerative therapy, it basically uses the stem cells to grow out the tissues and bones. So it is the restoration of the original condition of your joints. So that's the best way that you can maintain your health instead of cut it open and replace it with artificial parts and introduce alien objects into your body. So these are some examples that regenerative therapies and stem cells is superior than medicinal or surgical procedures.
Fascinating. How about solutions or for younger adults? Anybody between 30 to 60? What can this do?
So, for technically speaking, for any human being that um, we need to swap out our cells, no matter how
Mm-hmm.
young you are or how old you are. It's just in your younger time that regeneration speed and velocity is stronger. In older time, it is not as strong. So for younger adults or human being that we still get sick, we still get injury. Say if a teenager that had a bone fracture, whatever reason, sports,
Mm-hmm.
then to help them to heal during the recovering, a a sufficient amount of stem cell will help. So even for younger adults, a stem cell will help in need. So in general situation, if they don't sustain injury or sickness, there is no need. But if you have a medical situation and health situation that you need to recover from a certain diseases, then stem cell is definitely going to help.
Wow. Very interesting. Because as we were talking back in Austin, one of the things that people really care about is this is a big deal for a lot of people to stay healthy, because health is one of the things that even if we had a lot of money, is no way to buy it back. Like if you're not healthy, but apparently there is a way to find an improvement on your health that can actually not only help you with your current health, but also extend your life expectancy. And we were talking about, I would like your take about life expectancy. when using these type of treatments that definitely can expand based on these treatments as opposed as without using them, right? Let's talk a little bit about that, Dr. Lynch.
Sure. Let's get more focused on this question. Extend the lifespan, right?
Mm-hmm.
Okay. Let me use a metaphor of driving a car.
Mm-hmm.
Right. So when we drive a car, if the car drive more than 300,000 miles, then all kinds of parts is going to break down. And gradually there is a threshold then when some core parts that breaks down, then this car is no longer drivable. So it's just like our human body. To a certain degree that when the aging reach a threshold, then some major functions of our human body system not going to sustain. So that will means a termination of life, which is death. So before the declining of the major organs and the whole system reach the threshold that we do the maintenance, it's just like you drive your car to do the maintenance, change oil, and swap out those damaged parts, and strengthen those aged and damaged parts, that it will help the whole system operate longer and healthier. So if you have a good oiled, a good, well-maintained car, we can easily find some car that drives more than 500,000 miles or even longer. But if you do not do the maintenance, don't change the oil, then probably it's going to die much sooner than it is designed. So regenerative therapy, it is the same mechanism that we prolong and maintain our organs, systems, tissues through the cellular level at a better condition. Swap out those aged, damaged tissues and cells with the healthy, younger, stronger cells, because stem cells can morph into our body cell. So especially when our own body cannot produce enough stem cells to repair them, then you introduce the sufficient supplements from healthy donors. So that's the way to enhance the body condition through the cellular level to repair the aging tissues and improve the overall situation and condition of your organs and system. So that's the mechanism to reach longevity.
I love the metaphor, Dr. Lynch. That was super powerful because, yeah, if we keep the pieces of the of the puzzle like in good condition, or we use newer versions of it, then definitely we're gonna have a newer model for a longer time, and that also shows not only for health purposes. I mean, we are gonna actually have a healthier body, but also youth, right? Like, let's talk a little bit about the cosmetic side of that, if we may.
Sure.
What does it mean?
So actually, the overall aura and appearance, it is a part of our life. So let me ask you, do you know what is the biggest organ of our human body?
Heart? The skin. The skin.
Organ. Yes, skin is our biggest human organ. So the beauty of a person largely rely on how our skin condition is. As regenerative therapy, that it improves the overall condition of our organs. And our biggest organ, which is our skin, obviously has the biggest benefits if we introduce regenerative stem cell therapy to our body. So it can be done anytime, but of course, it will be more meaningful for more senior human beings. And that's one thing. Another thing is when you improve your overall body situation, your digestion, your circulation, your energy is better. You can cope with the everyday life stress much better. And that improves the overall condition, like your joints are strengthened, your muscle is tighter, right? So the overall condition that you don't need to do as much of the liposuction, you don't need to firm your muscle and skin. So this is the true way of maintaining yourself in a very young, very effective, and very energetic status instead of using the so-called surgical procedure to disguise and change the physical shape quality of your own body, which has severe consequences and side effects. Because regenerative way, it is basically to restore the best form of your biological capacity of your organs and your whole biological body instead of change that artificially. So it does not have the side effect, the cosmetic surgery, like the fillers, you have Botox to tranquilize basically your muscle and your nerve system. So to reach the same result or even better result, regenerative therapies does not have the negative side effect the traditional surgical cosmetic surgeries have.
Wow, very powerful, Dr. Lynch. I'm sure a lot of our listeners are going to want to learn more about this. And this is backed by research. You are very big on research. Let's talk a little bit about your partnership with the university where you do the research on these topics.
Sure, definitely. So we have been partnering with many research universities, clinical hospitals, and clinics that conducting the regenerative therapies and cognitive recovery and prevention therapies. So currently, Noatech has 2 FDA pre-IND clinical trials going on, one with cognitive prevention, mild cognitive impairment prevention through stem cells and brain-computer interface. That's the 2 different methods. Another clinical trial, it is to document and preserve our cognition through a brain-computer interface. And for the regenerative therapies that Noatech provide services going through our partner hospitals. In the United States, there is a very strict regulation defining and restricted the regenerative therapies going on, and we comply with all the FDA requirements and the legal framework that we have our partners in Mexico and the other countries that it is allowed and completely legal and compliant. At the same time, the technology, the researchers, and the methods are all at the cutting edge, at the same level at the U.S. Research Institute's level, and the physicians are certified in both the U.S. and their own country. So that's how we can compliantly and confidently provide the regenerative therapies to interested individuals that to engage.
Love it. Absolutely. So very interesting. Let's talk a little bit about the technology because you are so big in technology and you are involved also in multiple high-tech initiatives. We talked a little bit about that before. How do you evaluate the new opportunities? Tell us a little bit about the other things you have in the horizon that you are seeing in the technology arena.
Sure. In terms of the regenerative therapies, that clinical trial is very important. So there are a whole set of protocols to recruit the patients to conduct the clinical treatment and to collect the data to do the double-blind test. So that's a very long process. It normally takes about 10 years for FDA to go through pre-IND to phase 1, phase 2, phase 3 to get approval for a certain procedure or devices. So that's a very long trajectory for any pharmaceutical companies to engage in a FDA approval. However, when we know a certain procedure that it could have the beneficial and positive result, it doesn't mean that it will immediately get approved by FDA. And in a lot of cases, it will take very, very long. And for financial reason and for other very practical operational reasons that it might not even emerge in the market available, like the drugs that you can buy over the counter or through a prescription. So research is one thing, approval is another thing. And a lot of people, especially for the body conditions that we need, to maintain the healthy cognition or our body, you might not want to wait for everything is approved by FDA or other health authorities, because the body is yours. FDA approval, it is one thing that it can be permitted to be sold on the market in a general circulation. But here is the discretion that every patient or candidates that to be well informed. You need to treat your own condition, your needs, and the time frame against the real situation of the market and the regulatory framework, and to see, do I have time to wait for that? As we know, let me use the cognitive impairment or dementia as the example. As we know, about 20% of the population will have dementia. And before the cognitive impairment progress into dementia, it will have a few years. So if you get assessment early and detect the early symptoms, then do intervention with regenerative or BCI or other intervention effectively, then you can very well stop the mild cognitive impairment, which we call MCI, before it progresses into dementia. And with the right intervention that you can maintain in this state for a long, long time, not progressing into severe dementia. And that's a dramatic improvement of the health. We know if MCI, it is not intervened, you do not take measures, 3-year progression rate, it is about 48%. So 48% of the people, if you have detected MCI, 48% of the people will become a dementia patient in 3 years. So that's very severe. But we know there is no cure out there, and regenerative therapy is not approved by FDA whatsoever. And in the foreseeable future, it is still a long trajectory. And that's your discretion that you need to take. Okay, and do I have other measures to prevent this? Do I have quality of life that I would like to squander around or waiting for the authorities to step in? That's the discretion every patient needs to take care of. On the other side, let's say for the beauty maintenance part, all right? So do I want to suck out my adipose, which is fat, risk the complications that sometimes it could be fatal? Do I want to inject implants into my body under my breast that a few years later is gonna harden and it's gonna suck into my circulation system? It could cause all kinds of very severe side effects. Do I want to inject Botox into my muscle and my nerve system to tranquilize? Basically, Botox tranquilize your muscle and your nerve. I cannot move my muscle. Or I want to really improve the quality and the condition of a muscle and my skin with regenerative therapies. This is a very realistic consideration. But regenerative therapy, it is not totally side effect free. It has a risk factor that I need to bring up to every single one of those who considering it. Because stem cells, it will grow your body much more efficient. So our body is comprised of our cell. So if you have a tumor, cancer cell in your body, it will let it grow faster as well. So if we discover that you have an active tumor in the last 5 years, sorry, you cannot do that. This is a big red flag. You cannot do that. Right. There are a lot of people that have the myth, a stem cell can cure everything, a lot of things, but it has a limitation. So if a candidate that has active tumor in the last 5 years, you cannot use that. Before we do the stem cell therapy, we have to conduct a thorough screening and make sure that there is no active tumor going on in your body. Then we are basically clear for a stem cell therapy. So from the scientific side, this is a very important precursor that we need to put before we make the decision.
I'm so happy you brought that topic because I think it's very important who is a good candidate and who is not. I know a lot of people are afraid to get older, especially because they are afraid to live a lower quality life because they are gonna suffer. They most likely will have a very limited health and mobility and things like that. Is this a good alternative to overcome that? So no people not only can get live longer, but in a better health condition, which is, I think, that the thing that a lot of people want, but maybe because people not only want to live longer, they want to live longer in a better health. Let's talk a little bit more about that, Dr. Lynch.
Sure, definitely. Yes. As a biological life form, our body ages. The aging, including the physical vessel of this biological body, as well as the cognition, or sometimes we call it the spirit of our life. So it's both part. That's why Noatech is focusing on both the biological regeneration as well as the cognitive health. So both are important. If we have a strong body but do not have a conscious and healthy cognition, then basically life does not make any sense to the owner of this body. So it needs to be go hand in hand. Both of them needs to be healthy. And regenerative therapies, especially through stem cells, it can greatly improve the physical and biological body. And at the same time, that it will de-inflame. It will take off the inflammation of our nerve system. It will help to repair those damaged and aging brain cells to prolong its expiration time, extend its lifespan, which means it makes it function better in your older period of time. So it is helping both physical part and the cognition part. And at the same time that we also have the brain-computer interface therapy together with behavioral therapy go hand in hand with the regenerative therapies to maintain the cognitive health. So we basically have 3 different approaches to maintain the cognitive health. For the biological body, that stem cell regenerative therapy, it is the primary vehicles. But for cognitive health, we have 3 different approaches that to maintain and improve the health condition.
Fascinating. Alrighty, Dr. Lynch. Let's talk about I'm sure a lot of people are going to be interested about this. What would be the next steps? What is typically what they need to do? They need to go through a analysis, right? A qualification process. Let's talk a little bit about that. And I'm going to make sure we're going to include that link in the show notes so people that are interested about this service or these treatments can get started there. And we can answer some questions.
Sure, definitely. So for any candidate or interested candidate that we need to do the initial consultation. So to assess the situation of the candidate's cognitive condition and the biological condition. So cognitive assessment that we can do in 2 modes. They can either come to one of our facilities to do the test, or we can send mobile assessor to their location, either it's at home or their office, to help them to do the initial. So that's for the cognitive health assessment. If they want to do their biological body, the physical regenerative health assessment, then we need to bring them to one of our affiliated hospital to do a full body screening and make sure that we de-risk the cancer factor and also get the baseline of their health condition. Then we can recommend the therapy protocols and the schedule. And of course, that needs to work with their time schedule and arrange the appropriate next step. So we need to do the assessment first, both for cognitive health and the physical health. Cognitive assessment, we can do mobile or they can come in. But for the physical health screening, that they have to come in because there are many items needs to do, especially for the cancer screening.
Perfect. Thank you so much, Dr. Lynch. And if Anybody wants to get in touch with Dr. Lynch, they can contact him through LinkedIn. And we are going to make sure to include a link here on the show notes with the next steps for these treatments. If anybody's interested about going through the qualification process and things like that, we will make sure to put it there. So thank you so much. Any final remarks on your end, Dr. Lynch?
Sure. I would like to thank you for bringing this information to your audience. And this is very important that we have the technology nowadays to maintain us in a better, healthier state, especially in the later part of our life, and taking the measure that it is available for us to live a positive life. It is more important than ever. The reason being, the technology's development, the speed of technology development might very well surpass the aging speed. So we kind of competing with time. And I believe, and I have very good evidence to believe that the capability of our technology to be able to make our life immortal, it is within the reach of our generation, which means that with the technology, we can outlive our physical body that can keep our cognition alive and thrive through a combination of carbon-based life form and non-carbon-based, silicon-based life form. But you need to live long enough to witness and testify this transition and transcendence to happen. So before that day, we need to maintain our physical body and our cognition in the right state. So when this singularity point happens, that we still have healthy enough cognition that to transfer or to fuse our life and cognition into the next phase of the civilization. So a lot of things are moving. All these moving pieces are competing for the time. We are running in a critical race with time. We know research runs faster than the product and the industry. The industry runs faster than the regulatory body. So a lot of regulatory system and the legal system is severely lagging behind what the technology has been discovering and developing. And the most important thing is, as a human being in this particular time that we are so fortunate to have the opportunity to observe and participate in the advancement of civilization and the life form as we know of, that we need the discretion and the well-informed decision-making to help us to live a better life, a better quality of life for our lifetime. So thank you for sharing this with our audience. If you have further questions, that welcome to check with Sylvia and also our company Noatech.life. It is a very simple website that you can check it out, and I'm looking forward to communicate with every one of you. And if you have interest, then discuss and move our life in a better form. Thank you.
Wow, Dr. Lynch, that was a very powerful closing remarks. And I'm sure we're going to get you invited for a second part of this fascinating conversation. We'll talk more about that. This has been such an insightful conversation. I don't know you guys on the other side of the podcast, but I've been really in fascination with this interesting topic. Thank you, Dr. Lynch, for sharing your perspective and the work you're doing with Noatech. There is clearly a lot of important information happening in this space, and it is so exciting to see these new ideas and how they are evolving. As we wrap up, just make sure to get in touch with, check out the website, noatech.life, and we are going to include another link here for more information, and you can reach out to learn more to either Dr. Lynch or check the website we're going to put here. If you enjoyed this episode, share it with someone who would love to find more information about this. We'd love to hear it. And as always, keep building your happiness one habit at a time. Thank you so much for listening. See you next time. Bye-bye.
Bye.